Welcome to North Florida Oral and Facial Surgery. This video will review the home care required after surgical procedures. After viewing the video, if you have any concerns, please call one of our office numbers and we will be happy to answer any questions. If it is after regular office hours, a surgeon will be available through the answering service to answer any calls. Mild bleeding is to be expected after any surgical procedure. While bleeding typically stops within the first 1 to 2 hours, it is not unusual for the oozing to continue many hours after surgery, especially if the surgical procedure is more complicated, such as with wisdom teeth or bone grafting procedures. Some minor oozing may even continue overnight. To stop the bleeding, fold a piece of gauze into quarters and place over the surgical areas. Apply firm pressure by biting on the gauze for 30 to 45 minutes. Change the gauze as needed until the gauze is light pink and no longer saturated with blood when it is removed. Gauze should not be necessary overnight. Avoid spitting or rinsing for the first 24 hours. Spitting and rinsing will disrupt the blood clot, which will prolong the bleeding. You may see traces of blood for many days, especially following meals and brushing. If you are concerned that you are unable to bring the bleeding under control, feel free to call for advice. Postoperative pain of some degree will always occur following surgery. It will usually begin within a few hours after the procedure when the local anesthetic has worn off. It is not unusual for there to be more discomfort on the second or third day after the procedure than on the day of the procedure. Prescription pain medication has been prescribed during your appointment. Please take as directed. If you are able, taking both NSAIDs such as ibuprofen and the narcotic pain medicine such as Percocet or Vicodin is okay. They work differently and can be taken together or separately. Do not drive or operate machinery while taking prescription pain medication. Swelling may occur and will peak on the second or third day after surgery. To control swelling, apply an ice pack to the outside of the face during the first 24 hours after surgery. Keep your head slightly elevated when awake and at night, using an additional pillow if necessary. Moist heat can be applied starting on the 4th day to help resolve any swelling that has occurred. Do not smoke for at least 4 days following surgery. Smoking will delay healing and increase postoperative pain. Most sutures will dissolve and fall out on their own within a week. If they become bothersome to you, they can be removed at your postoperative appointment if the surgeon feels it is okay to remove them. It is necessary to keep your mouth clean following surgery, but take care not to aggravate the healing areas. Avoid spitting or rinsing for 24 hours. Gentle toothbrushing should begin the day after surgery, but avoid the tender surgical sites. Salt water rinses done after meals can help to keep the surgical areas clean during the healing process. Good nutrition is necessary for healing after surgery. Be sure to aggressively hydrate by drinking plenty of fluids after your surgery. A soft diet such as smoothies, mashed potatoes, and soup is ideal for the first few days. Avoid hard, crunchy foods that could get stuck in the surgical sites, such as popcorn or chips. Slowly progress to harder food as tolerated. Avoid drinking through a straw, as this can disrupt healing at the sites. Everyone recovers from a procedure at a different rate. Use common sense and limit activity for the first few days. Slowly reintroduce exercise to your routine as tolerated, stopping if you feel tired or dizzy. Vigorous exercise should be avoided for several days following surgery. We hope you had a pleasant surgical experience at North Florida Oral and Facial Surgery. If you have any questions regarding post-surgical care that were not answered in this video, please call one of our offices to discuss any concerns that you may have. Thank you.